The World Health Organization says it now supports taxes on sugary drinks. It found raising prices by 20% or more actually leads to lower consumption and better nutrition. Dr. Francesco Branca is Director of Nutrition for Health and Development at the WHO. I asked why the organization is backing tax measures now when it didn't before.
Well, last year, WHO released its new sugar recommendation, and it was basically indicating that we should not exceed 10% of energy intake from free sugars, but we should not exceed less than 5% for additional health benefits. And then we've been working on policy measures to achieve this, and there are a number of policy measures. One of them is the taxation of sugar-sweetened beverages. We now have interesting data, and we have analysis done by different countries. We now have about 9 countries who have established this taxation, and we're starting to see the effect of these taxation levels. So the report comes now because we are starting to see some of this hard evidence about effectiveness of these policies.
So you're saying there is clear evidence higher prices translate into lower consumption and at the end of the day, healthier consumers.
Yeah, I mean, exactly. This clearly is different in different countries depending on the taxation imposed, depending on the structure of the consumers, and you have different effects also on different socioeconomic groups. So what we've seen in Mexico, for example, is that a 10% tax has reduced in a few months the consumption of by 6%, and in about a year, it has reduced the consumption by 12%. But then, in low-income groups, this decrease has been by 17%, which is a much more substantial decrease.
So you mentioned Mexico. Talk about some of the other countries that have the biggest consumers of sugar-sweetened beverages.
Yeah, at the moment, actually, the top consumer seems to be Chile, which has even gone past Mexico and the United States. And in Chile, the taxation was introduced in early 2015. And now this year, there will be an evaluation of the effectiveness of these measures. I mean, clearly, policymakers are extremely alarmed by the prevalence of overweight and obesity, which is scaling up very quickly, by the prevalence of diabetes. I mean, today is the World Obesity Day, and we've calculated that the amount of obese people in the world is over 600 million. And the diabetic people in the world are 422 million. This is a drama. This is an incredible number.
But Dr. Branca, surely this is not just about limiting sugary drinks. Obesity, diabetes, aren't other factors involved here as well?
Oh, indeed. I mean, this is a measure. But, unhealthy diet overall is the top cause for death, in premature death in the world. It's more than tobacco. And we're trying to see what type of measures are helpful to improve the quality of the diet overall.